Thank you for joining our session. Today we are going to discuss the mind-heart connection. We are born with a heart and a brain. So as you know, that's a package deal. It's not separate. And our body is going to inform our brain. So we're going to talk about that connection today in this video session. Stress is any outside force or event that has an effect on our body-mind. So I'm going to speak and talk today about the body-mind, again, as we have a body and a brain, so body-mind. Our responses to stress can be physical, mental, or emotional, and cause body and or mental tension. So as those of you know, those physical pains can come out in different ways. We can also have that mental stress that we have kind of when our brain is always on and we can't turn it off. I like to call it the hamster wheel, kind of goes in there. Our thoughts just kind of churn around in our brain. Or emotional, to where it affects our feeling and our affect. And as a result of that, our body can hold that tension. So think if your shoulders are tight, your neck is tight, cause tension, headaches, and ultimately can cause inflammation and other diseases within the body. So this picture is our window of tolerance. And if you focus on the middle section, it has like a little window there with an island. This is where we want you to be. Now, most times when we are stressed, stress shrinks our world, so our window is going to get smaller. But ultimately, you want to make your window as wide as possible so that you can handle a fair amount of stress with ease. Now, there are times where we would get what we call dysregulated. So if we dysregulate up, that is where we start to feel agitated. You can see the volcano at the top there. So if you're looking in the little orange section above the window, just don't pay attention to the big words. But basically, you're going to feel anxious. You're going to kind of feel like unsettled. You have energy. You're not out of control, but you aren't comfortable. So you might feel the need to kind of constantly be moving. You can't sit still. And then if you focus on the red box at the top, this is where you are extremely anxious or angry. Thus, we have the volcano kind of blowing its top there. And you could be out of control, okay? So you can feel overwhelmed, and you might feel that you want to either hit something, to fight, or you want to run away. Okay, so this is we're going to talk in a minute about fight or flight, and that's where you're going to see that in the brain. And if we look the opposite way, when we look down, we can dysregulate down, and that can be where we feel a little spacey. So if you look in that orange box below the window, below that little island, we will lose things. We maybe lose track of time. We start to feel a little sluggish, okay? Again, we're not out of control here, but we're also not feeling comfortable. And then if we look all the way down, you can see where the iceberg is to that red box. This is where we would call the freeze response. That's the little iceberg there. You feel extremely zoned out and numb, so both emotionally and physically. So not a lot of energy, not a lot of emotional or physical energy. You might miss time. You might feel that you're sleeping a lot. Okay? You might feel numb or frozen. Okay, this isn't something that you have control over. This is where your body takes control. Okay, so it's not something that, and you can think when down might be kind of like a depression state. Okay, so ultimately we want to get you back into your window. Okay, that's where you are calm, focused, and alert, and you're able to handle what comes your way. Okay, and you kind of keep what we would call a good balance. Okay, so here's the negative stress cycle. Okay, so the cycle can begin with a stressor or a symptom. Okay, so the symptom could be waking up with a headache, or it could be a thought about a relationship or financial issue that is not going well. And if you can kind of see, it goes in a circle, so it just keeps looping. So we start with the stress, and then another one can come along before we even have a chance to kind of handle the initial stress. So we have the stress, and we can see the automatic thoughts that come in. All right, so it could be positive or negative. And then we have that fight or flight response that we just talked about, where you start going up or down. And then you start having symptoms, physical or psychological, so they're going to manifest within the body and within the mind, then is going to cause more stress, and it just keeps going. Studies have demonstrated that we elicit the fight or flight response about 50 times a day, usually as a result of daily hassles. So again, doesn't have to be anything major, just our normal stress of living, of being human on Earth. Over time, chronic exposure can contribute to a multitude of physical, emotional, and cognitive behavioral symptoms. So, the thought is, how can we begin to break the cycle for the negative stress cycle? Okay, so as we move on to the fight, flight, or freeze response, we touched on it, but I do want to make sure we remember that at our basic level, we are still mammals. We are animals, okay? We obviously have a more developed brain than these animals that are pictured here. But when we think about fight, flight, or freeze, it's easy to think about it in terms of these pictures. So if you look at the tigers, that's our fight response. So we as human beings, we also have that fight in us. And you can see in the bottom with the cheetah, and I'm not sure if that's a gazelle or what animal that is that's running, but that would be the flight. So within us, the fight flight is what we would also know as anxiety. Okay, so our brain we are attempting to flee from something or to fight something. And then you see that possum that's playing dead up there in the right corner, and that is the freeze response. So oftentimes you'll see people who are freezing, you might zone out. That's how we attempt to freeze. We kind of shut down in the moment. We're not present. So, and once again, that's our fight, flight, or freeze, and we all do that as well as because we're human. All right, so this is another way to think about it. So this is a kind of another similar picture. Again, don't pay attention to any of these big words that are listed on here, but if you look at the green, the red, and the blue, it's kind of similar to that window of tolerance that we have. But I did want to bring your attention to when we're in flight or fight in the middle in that red. So some of the things when we are attempting to flee, so the flight, is we might feel panic, fear, anxiety, worry, or concern. And then when we're in the fight mode, that would be anger, rage, irritation, or frustration. Okay, so we're still thinking that we can do things during that time period, but our arousal is up, so we're not down in that green zone that you see at the bottom. So what will happen during that time is our blood pressure will increase, our heart rate will go up, we'll have more adrenaline, more oxygen will be moving to our organs, our pupil size will change, and then we also have the ability for blood to clot. So the body is preparing for the fight or flight. Okay. What also decreases during that time is our ability to relate to others decreases, our immune response decreases, digestion slows, our saliva slows, we don't store as much fuel, and the insulin activity goes down. So that's when we're in the sympathetic nervous system. Those are some of the things. So you might feel, you can hear your heartbeat. You can feel panicky. You can start to feel clammy or sweaty. These are all symptoms that you are in fight or flight in the moment. If you focus on the blue is the freeze response. So again, it's like going down where we were talking about in the window of tolerance, even though it's up top here. So this one you would have numbness, depression, helplessness feelings, We're going to conserve energy here. So think our body is essentially collapsing, okay? It's going to shut down. And really what the body's doing is it's preparing for death, okay? We feel trapped. We might feel some shame. And some of the things that are, this is an emergency state within the body, okay? So what increases is we increase our fuel storage and our insulin activity, and endorphins that help numb and raise our pain threshold are increased. Our heart rate will drop, our blood pressure will decrease, temperature goes down, our muscle tone, facial expressions, they all go down. We don't maintain eye contact. Our awareness of voices decreases, so we don't hear as well. Social behavior decreases. Again, we're not able to connect with others. Sexual and immune responses also decrease here. So that is the freeze response. And if we look down in at the bottom, the social engagement, this is where we feel safe and connected. We are oriented to our environment. So we feel joy, we're grounded, we're in the present, we're curious, open, compassionate, and mindful. Okay, that's where we want to try to stay, is in the green area. So our digestion is good, our resistance to infection is increased, we have an increased immune response so we can fight off diseases, we can rest well, we're able to sleep, we're able to recuperate, our circulation is good, we're able to connect with others. So the oxytocin, that's what the chemical that's produced in the brain, it involves us connecting to others. We have more of that. And all of our defense responses that we've listed in that red and the blue, those all decrease. So again, this is fight, flight, or freeze. So we're open. We're curious about our world in the green, and we want to stay there. And when we're open, our body is also open. So the breath is very important. It is a connection between the brain and the body. So I want you to think of the breath, it's a reset button between your brain and your body. It is very, very important. Okay, that is why so many different breathing techniques that we're going to touch on work well, because the breath helps to calm the body and the brain. Some other things that will help you to relax that you can do is meditation. Okay, that's going to be also like mindfulness. Yoga is really great because that is like a moving meditation. It combines the meditation with the breathing. Progressive muscle relaxation. That is where you tighten and then release your muscles in a certain order, and then you can feel that relaxing response in the body. And then of course we mentioned mindfulness. If you go online and look, Dr. Wheel, as listed here, has a 4-7-8 breathing technique that is very good. That's going to be an inhale for 4, you're going to hold for 7, and then you're going to exhale the breath for an 8 count. So 4-7-8. And then there's also something called box breathing, or a 4x4 breathing technique. So you're going to inhale for 4, you hold it for 4, you exhale for 4, and then you hold that exhale for 4 count. And we also have a pranayama, which is a deep belly breathing, which is a yogic breath that they use in yoga, where you're getting that deep breathing from your belly, which is much better than just breathing from the chest. You guys can think about when, if you've heard of people having panic attacks, often it's coming from the chest in a shallow, and this is where you're breathing more from the stomach. So all of these things are using the breath and then also the body to relax. All right, now we're going to move on to the section about thoughts, negative self-talk, and communication. So we all have what are called automatic thoughts. Okay, these are free-flowing. It's a stream of thoughts, wishes, and judgments. And in yoga, they talk about the chatter of the mind. So you can think about, you see somebody walking, you automatically notice something about them, and you may think something. You may judge them. You could think, oh, they have purple hair. Why did they do that? So again, these are all these little things that we think, and we all have them. These thoughts are shaped by underlying expectations and beliefs that we have. So as long as we're in touch with reality, our stress levels are normal, okay? If it's distorted, our stress is going to increase, okay? So again, if we're within our window, we're going to have probably more positive automatic thoughts, and if our window has shrunk, we're going to have more negative thoughts. So the negative automatic thoughts are going to have a negative impact on our moods and feelings. It's going to limit our ability to problem solve. It's going to reduce our ability to cope. Produces physical symptoms within the body. And so these physical symptoms are also going to be negative physical symptoms. So remember, we're not going to think negatively and then we're going to feel good in our body. So if we're going to think negative or bad thoughts, we're also going to have negative feelings happen in the body. And it's going to encourage unhealthy habits. Okay, so we're going to do things that maybe aren't always the best for us. What we want to think is, how rational is your thinking? Okay, and that sometimes might be tough for us to see in the moment. So how can we cope with these negative thoughts? Okay, we want to make conscious choices rather than reacting. And sometimes all you need is a breath. Remember the breath. You can take a breath, so then we can choose rather than react to things. This enhances our stress hardiness, so we're able to handle more stress, and it involves a balance between letting go and having control. So it's always that matching our efforts with ease, which is going to be a constant process in our life to find that balance. We all can use editing our story. So what that would be is, when we had that question up there, how rational is your thinking? Remember, we want to stick to the facts, not to the story. So when our brain, when we don't have enough information about something, it's wired for narrative. So we're wired to make up stories. When we don't have enough information, we need to fill in the blanks, okay? So we need to ask ourselves, okay, is that true? Do I really know that's true? And then you can say yes or no. And then it's, can I really know for sure if I think it's true? Is there a way for me to know? Yes or no, okay? So we want to constantly be evaluating those thoughts that are coming in. Is it really true that that person is a bad person because she had purple hair? Can I really know that for sure? And why am I even thinking about that? So how do you begin to shift your state in the moment? How can you shift out of that negative thought into where you want to be? All right, so there's really 3 things that you can do when you're kind of coping with these negative situations. We want to look within ourselves, and we can change within ourselves what we can change, right? So again, looking at our thoughts, looking at our judgments, where do we want our energy to go? The second thing we can do is we can change within our environment what we can change. So there may be a way that we can ask for help. Something, if you're in a nursing environment or in the hospital, you may ask, for some assistance to have something set up for you so that you can be your best. And that may look like, having equipment brought to you. That may be having a social worker come talk to you. So again, you're changing things in your external environment. And third, if neither of those 2 things are working, it may be that the situation has changed and that it is no longer healthy. You may need to leave the situation. So these are 3 coping strategies that you can have at your disposal at any time. And remembering that really we have power within us, limited for what we can control within us. And there's only certain things externally. We really can't control external events. We can control what's within us, and then we can help ask for change where we can externally, or we can leave. We also want to take a look at our boundaries that we have. Boundaries are very important, and you can see there I have boundaries equal respect. So we want to check in and say, where are our boundaries? Boundaries are essentially what's okay and what's not okay. All right, and unfortunately as humans we're not good at setting boundaries. We care more about what people will think of us, and we don't want to let others down. So we need to learn to say no. Okay, boundaries are directly tied with being able to know yourself and to kind of self-reflect, knowing your limits. Okay, knowing what you can do and what you can't, and then also knowing others. Okay, so and the more we learn about ourselves, the more we learn about others. So we can say what's okay and what's not okay for us, and that way we have self-respect, and then others will respect us as well. Okay. Effective communication, again, human beings, we are not good at communication. We all struggle with this. So we tend to blame a lot. We tend to use, you did this and you made me feel this way. And when we kind of break that down and we look at it, can anybody really make us feel a certain way? No, they're not in control of our emotions, and sometimes neither are we. So how we can effectively communicate is we can use I statements. So I statements look like what's listed here on our screen. So we're going to start with I was blank, and you're going to fill in the emotion that you have. Okay, and you're going to fill in the behavior, and again we're going to practice looking at people, separating the person from the behavior, okay, because we all do this. And then because I blank, fill in the explanation. So it could be, I was angry when you yelled at me because I am very sensitive to loud voices. That could be an example. So again, practicing using the I statements. We also want to have positive social connections. Okay? We know that social interactions regulate our nervous system, meaning that we help to co-regulate each other. So that's why oftentimes when we're feeling a certain way or we're anxious, if we talk with someone, a friend, a therapist, a family member, we may feel better because we are getting help in regulating ourselves, okay? Because through our interactions with others. Okay, that's why it's important to find those positive social connections, because it can also work the other way as well. The brain learns best in interactions with others. So we know that we have a social brain. That's how we learn, okay? That's why kids learn through play. We learn as we come into contact with other people. But we want to make sure that we have positive social connections again, because we can also be learning things that aren't good for us, right? We know that positive social connections grow the brain. And that's what we want to do. We want to make sure that we're social. And remember, if you go back to that blue, red, and green, when we are social, we are open, the body is open, and we are able to connect with others. And it's all about connection. So we know that the greater human connection that we have, the more that we feel valued, supported, respected, and secure. And remember, when we're also feeling connected and having those positive social connections, our body can also be at its best, right? And lastly, we need to make sure that we also don't leave ourselves out. So we need to have some self-compassion, because our unaccompanied experiences and memories live on within us until we meet ourselves with warmth and empathy in these difficult places. So there's a direct correlation with how we interact with ourselves, and that's how we interact with others. So we need to make sure that we don't sell ourselves short, and that we practice self-compassion and good self-care to ourselves first. You guys may have heard, or if any of you that have flown on a plane, and you have your loved one sitting next to you, and the plane is going down, who do you put the oxygen mask on first? Many people will say, on the person sitting next to me. And that's not correct. We have to put the oxygen mask on ourselves first. And that is not being selfish. It is necessary, because others, if we're taking care of other people, they can only be as good as we are. So we have to put ourselves first. And that means having compassion, taking good care of ourselves and our body so that we can interact successfully and have as much of a stress-free life. I don't think it's possible to have no stress, but for us to be our best and our bodies to be healthy.